And welcome back. Well, sometimes you don't realize what you've got until it's gone. And when you have an injury in your knee or your shoulder, everyday life can become extremely difficult.
And joining us today to chat about the latest advancements in orthopedics is Dr. Samuel Steiner and Dr. Christopher Kilian, two surgeons from Orthopaedic Associates of Wisconsin. What's up, guys?
Thanks for being here.
And I see you brought some friends to demonstrate what we're talking about. And as we told you during the commercial break, Tiff had shoulder surgery. It's the hardest two words to say together. Yeah. Fairly recently, but a lot of people, you run into so many people, whether they're athletes, professional athletes like Tiff, or they're just your everyday whatever. A lot of people have shoulder injuries, and you hear a lot about how difficult it is to recover from shoulder surgery.
Yes, it can be a very difficult rehab, especially with a rotator cuff repair or a slap repair like you had. There's a long rehab process, and that's what we're lucky at Orthopaedic Associates of Wisconsin. We have our clinic, our surgery center, PT, MRI, all right in the same place.
Yeah.
So we can help the patient recover and get back to it as quick as possible.
It's hard. I didn't realize until I had the surgery where they're like, the shoulder's the only joint that has to go like in full circles. Every other joint just goes up and down, so it's such a difficult recovery because it's such a unique and special joint. Who knew, right?
It's a very mobile joint, exactly.
Yeah, and I think that for a lot of people, until something goes wrong, until you injure something, you don't realize how important it is to take care of your body. One of the things that you do is meniscal tears, and this is something that happens a lot with like young adults and with athletes, and I'm sure you guys are seeing a lot of young athletes doing sports coming in and truly just injuring their body.
We are. We're seeing quite a few. We have the ASAP clinic, so a lot of young athletes are coming in on Saturdays after Friday night games, and the knee is a very common location to have an injury. And so
that's a knee right there, huh?
Here you have a knee.
Okay.
The femur, the tibia. If you look inside.
Now, what's the pink or this colored stuff? Is this the tendons?
So these are the ligaments. So these are actually the tendons here. You have the MCL here, the LCL here, and on the inside you have two fibrocartilaginous structures. That's the vocab word for that.
That's what I thought it was.
We'll quiz you at the end.
Yeah. Do we have to spell it too?
But anyways, you have two menisci. All right, on the inside, they're basically two large C-shaped structures, and they're really responsible. They're basically shock absorbers for the knee.
Yeah.
And so young athletes will have tears in the meniscus, and if it's a small tear, that can relatively be treated with just a small meniscectomy. Basically, you're just removing a small portion of the torn meniscus. But there's other larger, more complex tears that, some would just say just take out the whole meniscus. Well, obviously you need it. It really has an important function of spreading out the force in the knee. And so basically there's newer techniques to repair the meniscus, no matter how complex it is, to preserve it so that you don't get arthritis at an early age.
When you hear people getting like knee surgery and stuff, is that often what the issue was? Is something with the meniscus?
Right,
or?
more commonly the meniscus. You can have a lot of other things inside the knee, whether it's the cartilage has a problem or maybe one of your cruciate ligaments as well.
Yeah.
And you mentioned the ASAP clinic. So obviously your goal with a lot of athletes is they just want to get back out there, regardless of what sport it is. They want to get it fixed, they want it feeling better, and they want to get back to playing as soon as possible. Is that where this clinic comes in?
That's exactly where it comes in. You don't have to wait for that appointment if your doctor's busy. You don't have to wait a couple weeks, or in some cases a couple months. You can just go in that same day.
What about total shoulder stuff?
Yeah, so
It's like everything, it hurts me to say it.
exactly. So just like a hip and knee replacements, the next most common is the shoulder replacement. So here I have a model showing a shoulder replacement.
You guys all have your
I just gotta tell you,
exactly.
I've seen these models way too many times in the last 6 months. This is how it works in circles.
Exactly. That's what we're able to do now. So at our surgery center, we're able to do this as an outpatient surgery. And so what this is showing a total shoulder replacement. This is
wait, I don't get it. So
that's
are
your
these
shoulder
two
socket.
shoulders?
Yeah, these are two separate shoulders. So let me take this one away.
Thank you.
Yeah.
Okay.
And so with this shoulder replacement, so we put a metal ball on the top and actually a socket that.
Do you have a metal ball now?
No, I've got anchors now.
You didn't have a replacement. You had an arthroscopic reconstruction.
Correct.
Exactly.
Okay.
So what we do is we put this stem or the socket into the stem into the bone, and then we put a new metal ball on top where the bone used to be. And then on the cup side or your shoulder blade, we put this polyethylene, a high-grade plastic, onto the socket. And so then this forms the new shoulder joint.
Oh, wow.
And what we're able to do at Orthopaedic Associates, we're able to do this as an outpatient surgery. And then part of the new technology that we're
Really?
Yeah.
As an outpatient?
Yeah, so you can come
same day.
exact home same day, or you can stay overnight if you would wish.
You should stay overnight.
I know, exactly. I know. Yeah, but we have the ability to do it that quickly now. Exactly. Also, part of the recent advancements that we're doing, we're potentially the first in Wisconsin to do a new computer-navigated one where we're actually using a computer system and a live CT scan during the surgery to implant this is the most difficult part of the surgery, is implanting this cup part into the socket. So we can do that during surgery.
Can you guys both speak to just quickly, what are you doing to help people recover? Because some things like this seem fairly involved or complicated. Same with the knee. I mean, these are joints that we need all the time. How are some of the latest advancements helping people to, maybe even if they're not getting back to athletics, but getting back to work, getting back to their normal routines?
School, anything.
School, yeah.
So we're doing more procedures arthroscopically, which means smaller incision, less pain.
You can barely even see my surgical scars.
Exactly.
Right.
Very cosmetic, and actually it helps. You can do the surgery all through just a small scope, a little tiny poke hole.
Yeah.
And as a result, you don't have the big incision, not as big of a recovery, depending on what you're doing.
And less pain.
Although I think the smaller the incision, the less people think you had done.
Exactly.
They're like, where are the scars? And you're like, trust me, it was a big surgery.
Yeah, you're not getting babied as much, maybe. And
Yes, it's true. Sometimes you just want a big old laceration.
Exactly.
You know, to prove how bad it hurts.
They always ask, well, how many sutures did you have? Like, just one.
That's gone.
Yep, underneath the skin.
It's just
all that stuff.
butterflied.
Exactly.
Yeah, but it's wonderful
amazing
that
what you guys do.
Yeah, and you have this 24-hour surgery center, which is wonderful for patient satisfaction, the quality outcomes that you have, and lower cost often than traditional options. So in addition, you also offer what you mentioned, which was the Ortho ASAP clinic for acute new injuries. You can walk in anytime, no appointment necessary, Monday through Thursday. They have hours Friday as well as Saturday too. Call now at this number. It's 262-303-5055 to schedule an appointment with one of their board certified surgeons. They also have specialties specific to your individual needs. Thanks you guys so much.